Hello everyone, I'm Dr. Radhika Sherkhane, Professor and Head Department of Pharmacology at STM College of Medical Sciences and Hospital, Dharwad. I welcome you to this second session on the STM University Faculty Development Program on Question Bank Preparation. In this session, we will be discussing about Bloom's taxonomy with special reference to the cognitive domain. This session is particularly important because it handles the Bloom taxonomical levels. Bloom's taxonomy forms the foundation for competency-based assessment, especially when we are designing balanced, defensible, and NMC-aligned question papers. The objectives of the session are as follows. By the end of the session, the listeners would be able to first understand the various levels of Bloom's taxonomy in the cognitive domain. Secondly, the students or the listeners would be able to apply these taxonomical levels to set questions at various levels and of various types of questions in respective to their subject. These sessions and the points would help the teachers to frame different questions at various cognitive depths using different formats such as MCQ, short answer questions, short notes, and long essays. The focus in the session today is not only on theoretical understanding, but the practical utility of question paper setting across the various health professional education courses offered in our university. Let's begin with various concepts required for this particular session. As you heard in the session 1 on the learning domains, as medical teachers, we need to know that the students learn across these three domains. The first domain is the domain of cognitive skills or the knowledge domain or the domain of intellectual skills. It deals with enhancing the cognition, the intellectual skills among students. The second is the psychomotor domain. It deals with the practical skills and is also called as the skills domain. The third is the affective domain. The student learns about affective skills, that is, skills of professionalism, attitude, and communication in the third domain. We need information about cognitive domain and the intellectual skills, especially while designing theory question paper. And therefore, in today's session, we will be discussing more on the knowledge domain or the intellectual skills domain. So let's go into the depth of various levels of the knowledge domain. The picture that you're seeing on the slide is given by Benjamin Bloom and is called as the Bloom's taxonomy. This deals with various levels of a student's learning and assessment in the cognitive domain. As you can see, there is a progression of learning from the base to the top of the chart. The learning among the students happen in a progressive way. It goes from basics to higher order thinking levels. So in this picture, you can see that the higher order thinking skills are on the top and they start from the base and rise up towards the higher levels. The Bloom's taxonomy has 6 levels, starting with 1, which is remember. Second level is understand. Third is apply. Fourth is analyze. Fifth is evaluate. And sixth is create. Now, at level 1, the student is expected to remember, retain, and recall the knowledge that the class has been giving. That the student has to remember, reiterate, memorize, and recall the facts that he or she has learned. The second level is about understanding, a step higher than just a recall. The student needs to comprehend the content information that has been delivered during the teaching learning session. The third level is a little higher than level 1 and 2. Here, the student needs to break down the various concepts and apply the learned information to each of these contexts. Level 4 is analyze. The student definitely breaks down the components into various parts and now establishes a relationship between the various components and comes to categorize, organize the content that he or she has learned during the teaching learning sessions. The level 5 is a higher order level where the student is evaluated and he is judged and how he critiques the learned information, and the student is expected to have a sound analysis based on which he makes appropriate judgments. Level 6 is the highest level of assessment wherein the student is expected to know how to create, formulate, synthesize a completely new information learned from various basic levels of cognitive domain. So for the ease of understanding, we can say level 1 and 2 are at recall level A, while level 3 and 4 are an intermediate level at the level of interpretation, level B, and there are level 6, 5 and 6, which are higher order thinking and higher order of assessment, which can be called level C or the problem solving type. Let us go one by one for each of these levels. The first level is level of remember or level of recall. The student is expected to recall the basic facts and concepts learned. Various verbs are used to frame the questions in this level 1 of cognitive domain. For example, the verbs could be define, list, recall, recognize, write, state, etc. To give you an example of a short essay question or an SEQ of recall type, you can see the question here. State the short-term regulation of blood pressure with the help of a labeled diagram. The label and the state, the verbs have been used to frame this question at level 1 of the cognitive domain. Now the marks distribution is also being given here as a structured entity. We can frame more questions in level 1, for example, in the form of a SAQ or a short answer question. It's a 3-marker question. You can see the use of verb list. List any 3 specific adverse effects and indications of calcium channel blockers used in hypertension. The 3-marker at level 1, where a student is expected to recall the concepts and facts learned and list them as an answer. So this is a basic level, the level 1 of cognitive domain. Let's go to level 2. The level 2 is when the student is assessed for understanding and comprehending a particular concept learned during the teaching learning session. Various commonly used verbs are enlisted on the left-hand side, which include describe, discuss, explain, classify, demonstrate, compare and contrast, etc. A few of the examples for level 2 questions include a short answer question of 3 marks. You can see the red highlighted verb used in the question. A patient with bronchial asthma develops wheezing after starting propranolol for migraine prophylaxis. Discuss a reason why this happened in the patient. Now, this level of question needs student to exhibit comprehension. It cannot just show or assess the recall type, and therefore it is a level higher than level 1, wherein the student has to exhibit his or her understanding of the concept. A few more questions of level 1 and 2. A structured long essay question or SLEQ can be framed like this. Define blood pressure, mention its various components and write its normal value. Describe the short-term regulation of blood pressure with the help of a labeled diagram. The distribution of the marks here is also very clearly stated. Both level 1 and level 2 questions have been asked in a single SLEQ. The verbs define stand for level 1, while the verbs write and describe designate level 2. And therefore, you can see this is a hybrid question wherein both level 1 and level 2 can be assessed in a single question. Few more questions, examples for level 2. An SLEQ wherein the question reads like classify antihypertensive drugs, describe the mechanism of action, uses and adverse effects of enalapril. Now, this is a structured long essay question with various components given here, and you can see the marks distribution and the verbs used which indicate level 2. This is not just the recall of facts, but also about description and classification. Another example of an MCQ at level 2, this is a scenario-based MCQ, and now that the MBBS 2024 guidelines by the NMC state we need to have scenario-based MCQs, this stands as an example for creating such ones. A 56-year-old man with essential hypertension is started on enalapril. After a few days, he complains of persistent dry cough. Which of the following best explains the mechanism of this adverse effect? It's a 2-mark MCQ at level 2. The student has to exhibit comprehension and understanding of the concept and has to choose one appropriate correct answer based on the understanding as to why this adverse effect developed after giving enalapril in this patient. So you can see that MCQs, SLEQs, SAQs, and short essay questions can also be framed at level 2 of cognitive domain. Another question is a short essay scenario-based or application-based question here on your screens. Now, this is also an NMC requirement. The question reads like this. Kirtan, aged 18 years, went to the class after running for 15 minutes. His heart rate increased to 130 beats per minute from its basal value of 70 beats per minute. What change could happen to his systolic and diastolic blood pressure? Describe the regulatory mechanism which would bring back his blood pressure to normal. Now you see this is a structured question and the division of marks and the subset of questions have been clearly stated. The verbs have also been appropriately used and therefore this also serves as an example for a scenario-based SEQ, which is one of the mandates for our question paper bank. Moving to level 3. The level 3 means applying the learned information in real life situations. Now you see here that the commonly used verbs include apply, solve, interpret, show, illustrate, calculate, etc. This is one level up than just recalling and understanding the facts. Not only that the basics of recall, understanding are required, but the student here is assessed for the application of the information that he or she has learned. To give you an example, an MCQ of 2 marks where the application of the learned knowledge can be assessed reads like this. A 58-year-old man presents with acute pulmonary edema with severe dyspnea and basal crepitations. He requires immediate symptomatic relief. Choose one of the following diuretics to be given intravenously to achieve rapid improvement. So one of these options is the right option and the student has to look into acute emergency situation needing symptomatic relief and to be given by the intravenous route. So obviously it does not rely just upon the recall or memorizing the facts. The student will have to know all the basic information and then apply the knowledge to choose the right option. So this is at level 3, a level higher than just recalling and understanding the facts. Level 4 is about analysis or analyzing by breaking down the components into smaller aspects and understanding the relationship between the parts. Now let's see the common verbs that are used: analyze, classify, compare, contrast, differentiate, etc. To give you a few examples at this level of analyze is a patient on warfarin therapy develops bleeding after being prescribed cotrimoxazole. Identify the pharmacological basis of this drug interaction. So this is a reasoning type of SAQ of 3 marks. Standing at level 4, this is because just the recall, understanding, or just application of the knowledge is not sufficient. The analysis of relationship between the two different drugs and the resultant adverse effect is essential. So this lies at level 4. A similar question can be framed for a 5-marker short essay question, wherein the words compare and contrast can be used. As is shown in this example, here are two different components like of benzodiazepine barbiturates in various aspects, that is mechanism of action, safety profile, clinical relevance, are being assessed for the comparison. The student has to first break down the components in these mentioned criteria, then show the relationship by comparing the similarities and contrasting the differences, and then write the short note. Therefore, this is a level higher and fits into the level 4 question of our Bloom's taxonomy of cognitive domain. A few more examples. Now, what example you're seeing on the screen is a hybrid example of an integration module, or what our NMC suggests that we include some short notes on applied aspects and integration. So one such question reads like this. Mr. Kalappa, aged 40 years, visits the physician complaining of headache and blurred vision for 3 months. On examination, the systolic BP was 170 and diastolic was 100 mmHg. He is now diagnosed to have hypertension. Now, the question reads various aspects. One is to calculate the mean BP. Second is to find the physiological basis of the two symptoms. And third is to differentiate between the two primary and secondary hypertension types. You see that each of these questions is at a different level of the cognitive domain. The first one is at level 3 of apply, second at level 2 of understanding or comprehend, and the third question is at the level 4 of analyze. Now, because this has all the 3 levels which can be assessed, this is a hybrid question. It is for the integrated module on hypertension, and therefore such questions can also be framed to assess the integrated modules. Level 5 is of making judgments based on the criteria. This is at the level of evaluate. The commonly used verbs are evaluate, justify, assess, conclude, judge, prioritize, etc. To give you an example, evaluate the role of beta blockers in the management of hypertension in patients with bronchial asthma. As you see in this short essay question of 5 marks, why the level 5 is indicated is because the answer to this question should include these various concepts. That is, a student has to give a brief statement of role of beta blockers in hypertension. The student also has to show the risks of using such drugs in bronchial asthma, also has to indicate the relationship between selective and non-selective drugs during the treatment of hypertension with bronchial asthma, and finally conclude with a judgment as to which of the drugs among the selective and non-selective would be best and appropriate for the patients with hypertension and coexisting bronchial asthma. Therefore, this kind of a question requires the student to not only have basic information about the disease, about the drugs, about recall, understand, apply, evaluate. Now, here is where he has to actually make the judgment and give his opinion based on the criteria. Therefore, this is a higher order thinking question and can be assessed at level 5 of cognitive domain. Question 6 is the level 6 is the highest level of cognitive domain assessment. It means create, or the student is expected to put elements together to form an entirely new structure. The commonly used verbs include design, compose, propose, formulate, develop, design, etc. Plan can also be one of the verbs which can be effectively used while framing questions in this level. To give you an example of such a kind of a question, a CQ of 5 marks can be designed like this. Design a stepwise antihypertensive treatment plan for an elderly patient with isolated systolic hypertension and chronic kidney disease. This is a 5-mark question at the level of create or level 6. The student is expected to answer the various components in the question. For example, the student has to identify the patient-specific issues in this question, also has to give the selection of preferred drugs or first-line drugs with the justification for the choice. The student also will have to mention about add-on therapy and dose calculations and considerations. Also should follow up about monitoring parameters and precautions needed in such a case. As you can see, it is a highest level of assessment in this cognitive domain. That's because not just about recall, understand, application, evaluation, analysis are enough. Here, the student will have to actually plan for treatment, and therefore he or she would synthesize and create a complete new prescription. And therefore, this stands at the level of 6 in the hierarchy of taxonomical domains of cognitive domain. So to summarize, let's see one of these slides with one simple example so as I can recollect what all we read till now or understood till now. That is, the cognitive domain starts with the knowledge domain as the basic level, that is remember. Second goes ahead with the level 2 of comprehension or understanding. Third, application. Fourth, analysis. Fifth, evaluation. And sixth is create or synthesis. The first level is about recalling the facts learned. Second is about understanding and explaining and reinstating the learned ideas. Third is the ability to use the learned material and applying it in real life situations. The fourth one is to analyze the various parts of the problem and then finding the relationship between them. Fifth is the ability to judge for the material against the stated criteria and the limitations. And finally, sixth is the one where the student is able to create, synthesize a completely new idea and help solve the problem. For example, if you have to fit all these in a single example, defining hypertension and the as per various guidelines would be remembering or recall type of an assessment. Classifying the various drugs depending on the guidelines given would be understanding or level 2. Using a particular antihypertensive therapy in some comorbid conditions like angina or congestive heart failure will be applying the learned information at level 3. Then assessing comorbidities associated with the hypertension and then finding out the treatment required for that kind of limitation or a comorbidity would be at the level of analysis or level 4, giving an appropriate prognosis, making a difficult choice, and judging whether the treatment plan is correct or no is at the level of 5 or evaluate. And finally, prescribing a customized prescription or a treatment plan for this particular patient would be by generating the prescription at level 6 or create the level of synthesis. So finally, we come to the conclusion of this session on Bloom's taxonomy. I'm sure that this would help all the listeners in framing appropriate questions for the question bank. Thank you for your patient hearing.